Get everyone well adjusted today. Woohoo! The only way to do a full body adjustment is to do it quick. If it were to take 2 hours to go through and check all 8 directions in every joint of the body, you guys couldn't afford the care. So here, just for the health of it, with my team, we've been able to practice our skills. Multi-generation chiropractors who have been working under other chiropractors for a long time, and highly skilled doctors who dedicate the majority, 80% of their day, to becoming better, will go through your body and check all 8 directions very quickly. And it looks like this. That would be face up. We would do face down. We can also check the tailbone. It just depends on how the patient feels. Some patients don't do well face down or face up. But you can notice how quickly we can check full body. If you don't get your full body checked, you don't really know what's going on, do you? So, and either does your doctor. So in the medical profession, you know, we got to pick and choose what we're going to look at, and we prioritize based on your exam. So, but every single patient gets a full body screen when they come to our office, because we will look at the whole system to make sure we don't miss anything that we're checking for within our scope of practice. So as we go through, we can move very quickly to make sure that it's a good price for you, getting a good answer efficiently. And if that were to take 2 hours, I'm not sure you would want to see that doctor, because it wouldn't be any better, it would just be more expensive. And full body chiropractic allows me to get rid of a dislocated knee, some tendinitis or golfer's elbow, a little bit of neck problems, some ribs from sleeping, maybe even some TMJ, and that poor person thought they had 4 different problems. Maybe they had just one problem, which was a bad upper cross balance system, and some cranial work would have actually reset all of them. Maybe they're severely right-handed and the pattern work would actually work for them. And in fact, when we remove the restrictions and we get full body cooperation and put them in rehab, their body remembers working together. So now they have a long-term permanent actually holding the work. A lot of people are going out there getting a rack 'em, crack 'em at one of these cheap parlor chiropractors where they pop a couple things, throw you in a machine, see you later, nice and expensive, or maybe worse, maybe $17.99 or $20. which is just gross. Nobody wants a plastic fork for $19.99, okay? They want a real fork for 70 bucks, keep it their whole life. That's actually cheaper. So getting a high quality product with some intelligence behind it, which is what you were looking for, which is what is wrong and what's going on, not a quick, I hope we got it was cheap, see you later. Big difference between full body chiropractic and a little bit of crack in your bones, hoping we got it kind of thing. The physics behind it. Let's pretend this is a necklace, okay? So if I were to just wear this as a necklace, most of you guys have seen this, guys and gals, okay? If I take the tailbone and just kind of pull here, and we use the interlinking of a necklace chain in synonymous with a joint, right? The joint is there, and you have one all over the place here, okay? So the sloppy joint, just like the weakest link on your necklace, if I tug on each end, is the first one to pop. So those of you adjusting at home, and those of you seeing chiropractors that aren't specific, you know, they're just kind of doing a whole area, or worse, the same adjustment every time you come in, you can walk out of there and guarantee that you can get a pop at home. Your uncle or whoever can try and copy him and get some noise. That's not really a treatment. What it does is it confuses the nerve so it doesn't work for a few minutes. So you feel like you get a little pain relief. Let me tell you, that's not chiropractic. I'm not sure what that is, actually. When we actually find where you're restricted, it's like a section in your necklace where a link doesn't work anymore. Now they're stuck together and there's no movement there. Our job is to find that. So let's say this one, this person's bending over and this is a link that moves too much. This is the one not moving. So in my office, we would actually support that with some K-tape, some rehab, some exercises, and then we would actually get that moving. So we can do an adjustment. So now you have a team, right? This one doesn't move too much. This one doesn't move too little. Bam, back to normal. That's real chiropractic. Getting a good adjustment is everything. Chiropractic works amazing, but finding one that does that, a little bit tougher, okay? If we do that full body with patterns, improve your balance, give you exercises, and work on nutrition, you will not fail, right? You get results every single time. The only patients that don't are the ones that don't want to put that work in, because it doesn't happen in one day. It's like trying to get a six-pack going to the gym once. So as long as you're willing to show up and do the work and listen to what's actually going on and work as hard as your doctor, it works every time.